welcome back to another exciting, informational, and just transformative episode of Mind Your Body and Soul. I am your host, Joseph Ward. I miss my co-host, Matthias Sweet. We're gonna have to get him back on here sometime soon. He'd be so busy, but I miss my co-host. So shout out to Matthias. But remember, this is the healthiest podcast that you have ever heard in your entire life. And the overall goal is to make sure that we are, that we are connecting our community members to the resources that are within our community. So think of this as a digital resource hub, and it's in conjunction to the resource hubs that we already have within our Tallahassee and our Tallahassee City and other resource hubs. So that's why we use our platform, and today is no different. Excuse me. But today we have a person who I enjoy. Her personality is amazing. I love listening to her. She is brilliant. Emily Saras serves as CEO of Knowli, a woman-owned research, analytics, and consulting company based here in the great city of Tallahassee, Florida. Her expertise in data science, academic research, and public policy has been honed through numerous degrees from Wellesley College, Central European University, Northeastern University, and the Florida State University. Under her leadership, Knowli has grown to serve several new governmental, nonprofit, and private organizations through the United States, providing public policy leaders with data-driven decision support. I welcome Emily Saras. Thank you for being a guest right here on Mind Your Body and Soul.
Thank you so much for having me and all of your really kind words. It probably sounds all kinds of fancy and impressive, but day to day we use math to help make sure that we're improving the healthcare of millions of people throughout Florida and the U.S.
Math is everything. Math is everywhere, and that's one thing I really learned. I know math has never been my favorite subject, but when you really break everything down, it comes down to mathematics, and that helps us to really understand things. So you are very good.
Well, here's the thing. I grew up, and I've been a nerd my whole life, but I grew up with so much math anxiety that I never even took statistics until I was 26. I didn't learn how to program until I was 26. I'm 35 now, so in a decade, I've realized how much, our education systems they build up math. There's so much anxiety. There's so many false narratives of like who's a math person and what constitutes as math. In our world every day, we're just counting up people, metrics, and we use big fancy AI and algorithms. But I think the key that's often missing in math education is that we use it for these applied purposes, right? It's not like, oh, I got a B plus me in calculus in college, so I'm not good at math. Like, we use it so much in our everyday, and it's how we measure the quality of the healthcare that, folks get through Medicaid, Medicare, other health insurance, and public health programs. We use math, and then a lot of, not false storytelling, but narrative building to help people understand how these really complex mechanisms all work together just to get and keep people healthy. So
yes,
we have a blast at Knowli.
Yes,
but it all really comes down to this idea. And we talk a lot too about, math was not the favorite subjects of the many, executive leaders that we serve in health or in government. And so we just try to make it as approachable as possible. We do a lot of translating of what the statistics really mean in everyday language. So I'm here not only as to talk about our career, but I guess as a math ambassador. I'll stop there for now, Joe.
Well, I'm a bit curious because we're definitely going to dive into your story and everything you do. But you mentioned you had math anxiety. I would say that's my whole academic career. So being that you work in a field where math is the root of everything that you do, how did you overcome your math anxiety to become like the titan in your field that you are now?
That's a really good question. And a lot of it has to do with, I think, just tolerating the uncomfortable and tolerating trying to work really hard, even if you're not getting it right. And I honestly, I know this is going to sound out of left field, but I actually didn't learn those skills as well as I needed to in college. I really
Mhm.
developed them when I pivoted and I went to Europe and was in conservatory and singing opera for several years before I kind of came back into my sociology quantitative world. And it was through that experience of no, you're not going to get it perfect on the first try. There's a lot of learning and discipline, and that doesn't mean you're bad. It just
Right.
means it's practice. And I think all the time, like if we thought about math the same way we thought about sports as a culture, that it's that patience of knowing you're not going to sink your first free throw. You're going to have to practice, and also that it can be fun. And that again wasn't my experience, but so in programming, in math, so much of that mentality is think about like debugging a program. It's wrong, it's wrong, it's wrong, it's wrong until it's right. Right. But when we're writing an essay, you can still get an A. I mean, if you kind of work your way around
Hmm.
things or play with your words, so you can get by. But there's got to be a lot of tolerance for the no, 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 no,
Yeah.
yes.
Yes.
And
Yes.
that's just a muscle to strengthen. I strengthen it every day. It's still hard for me in all kinds of contexts, but it's that thick skin. I'm still thickening my skin, but when it comes to math, knowing, nope, you're going to get it. You got to just
Right.
be comfortable. And also that's not necessarily how math is taught in the United States either.
Right.
It's
Right.
get it right, memorize instead of what does this number mean? What does it mean that we want to, you know, increase this number of cancer screenings? Why? That motivates people to understand the numbers more than
That makes sense though. That makes sense. But you being exposed to different ways of learning really helped the math become a lot simpler and something more practical. They gave it
absolutely.
to you in the practical sense.
I agree. And that I know. So now when we're spoiled with all of these amazing word problems in our job every day, it's okay, well, if we have this much money and these stakeholders on board, how many different ways can we, create an intervention that supports improved healthcare? And it's because it's so important and we know we're helping the lives of real people. All of the math, all of the AI programming and natural language processing that we do, it's motivated by the
Right.
impact. And we're really lucky at Knowli. That's how we're building our team is subject matter expertise and people who want to make an impact first. And then we can, folks have to want to do data science, but we can help coach any other skills you need if you've got those two things first.
Right. Now
Yeah.
that's amazing. I love that. I'm an advocate of learning. I'm an advocate of alternative ways to learn because I think learning needs to continue to evolve, especially with different
Yes,
generations, so we can get them involved and excited about learning rather than trying to give it to them the same way we had. So,
I agree.
yes. So, with that being said, I want to find out who is Emily. So, can you give us some background information about yourself and how did the world of IT research and mathematics, how did that just become on your radar? Because you also have another talent with that beautiful voice you have. So,
Oh, you're so
um,
kind.
so how did all of your talents and all of your ideas and just all of your wants lead you to where you are now?
You know, I myself am often surprised because I've been the product of a lot of luck and privilege and coincidences. And a lot of my experiences are because I just found things that were really interesting or puzzles I wanted to solve. And so, again, like from the time I was little, I was always reading and always singing. So the nerd in me started young. Um, when I applied for college, right, I was in a small town in Massachusetts, and I really wanted to be among the best and the brightest, and I thought that meant that smart girls who are good in STEM, they should be doctors. So
Hmm.
I was fully preparing to try to get into medical school, tried to, back when I was in, ninth grade, and
Right.
maybe overly worried about my grades and what the purpose of life is.
Hmm.
Uh, But instead, what happened is this little weirdo gonzo inside of me kept growing, and I would delve into topics that I found interesting by the time that I got to college. So,
Right.
one strange twist was, I'm in my organic chemistry classes and slogging through my pre-med curriculum. But an anthropology professor once, asked me about my Lithuanian heritage. And he said he studied, these post-Soviet countries in his anthropology work. And then, through a lot of different things, I realized, well, I can go and study the music culture that's in this country and learn a little bit more about what it means about society.
Mm-hmm.
I'm skipping so many steps, but with a lot of, encouragement, I ended up pursuing anthropology research there. I went to Lithuania for one summer, funded by like an undergraduate research grant. And what surprised me most, that the ancient Lithuanian folk songs that I was studying, and they're often sung by opera singers in certain contexts, so it kind of all blended together. But what shocked me is that I would see in the capital city of Lithuania, Vilnius, while I was there, I was watching these literal neo-Nazi protests happen. This is back in 2008 through 2011.
Okay.
And they would be singing these songs at these protests. And I would come back to my advisors in the US and I'd say, like, there are these really strong, like, skinhead movements and racism and neo-Nazism, and it happens in the streets. And the way that this was characterized then was, oh, this is kind of maybe post-Soviet space. Like, we don't have these kinds of right-wing attitudes in the US, they're going through a phase. And really what I understand now is that, no, there's a lot of social movement research that these movements have all been working together over the last decade to really change global politics. So I just happened to be in the right place at the right time where, I was giving concerts and still studying opera, but in these studying of state movement and politics, I started getting engaged with the embassy and understanding how people thought about social movements from a sociological perspective and how different movements use parts of the culture for good, bad, and ugly to try to change the views of people. And so, again, this narrative is that I've been maybe like French braiding lots of strange interests in my life together. But it was through this that I realized, like, wait, there's power in culture and in numbers to really shape what's best for society. And if we don't really think about all the little influences, we can develop really dangerous things in our society of hate, of racism, of all kinds of xenophobia. And it can seem insidious. It can just be in parts of pop culture. I should have mentioned that in these, the Baltic states, like real Eastern Europe, it's really common for thousands of people to get together and sing folk songs in stadiums together. Like, this is a thing people pay to go to, like sports. Yeah. It's very popular. Through this whole mix of this stew, I just started learning a lot more about what public programs do, how not just healthcare, but education and other big facets of society work together. So from there, then I end up, doing a year of AmeriCorps. I end up coming down to FSU. It's that classic Tallahassee story that I'll just be here for a year before I move on. And I've been here now 10 and a half years. So, and in that time, went to graduate school, started programming, and then since then, it's kind of been nonstop. I've done research in education, in public programs for especially racial ethnic minorities, especially those underrepresented in STEM or high earning careers that are often in the tech or STEM space. Yeah. And then when I joined Knowli in 2018, I came on to help grow the business and also do general research and analytics. And it was in this new environment where I could, again, see the government components, the metrics, the studying and research of interventions to improve people's lives, the challenging political narratives and debates. And how do you just make sure that you're improving public health amidst all of that noise? How do you help kind of cut to what's best for folks and keep them at the center? So yeah, since then, there's been a pandemic, there's been growth in our company, all kinds of fun challenges. It's all, again, a lot of word problems every day.
Yeah. So you've had a hell of a journey. Like
It's
you
still
need to
going. Oh my gosh.
you
I've been
need to
so
write
lucky.
volume 1.
It's been a blast. It's been a lot of hard work and a lot of growing, a lot of ugly times too. So I try to be open about how, if I think about 10 years ago, I did not know how, not only I just didn't have the expertise to really know what I was doing or how, but that didn't mean I wasn't worth jumping in and getting my feet
Right.
wet and starting. It's that same programming thing. You fail a lot before you succeed. So maybe I haven't mentioned those parts of the story, but there's been a lot of that too. It's a lot of up and downs.
But that's like you said, that's a part of the journey. 10 years ago, a lot of stuff that's happening to me now, you couldn't have paid me to say this is what I'll be doing. Like I had no idea Leadership Tallahassee existed 10 years ago. So
Wow.
that you know,
And now you're part of the next best class ever, and
I'm just saying.
And for folks who are listening or watching, right? It was really clear on our health and wellness day that we did that Joe is right in the heart and center of giving really needed care to people on the ground here in Tallahassee every day. You're one of my faves, and it's so clear the leadership that you bring. So 10 years ago, Joe just needed to know that there was a place where he belonged, and it was Leadership Tallahassee.
Right. No, yeah. I really appreciate that. I really appreciate that because I really just I want to make my community better. So that's my focus. So I try not to.
It's so clear. It's so clear you do. You're awesome.
I appreciate you very much. So tell us about Knowli. What is Knowli? How did Knowli start? And how does Knowli provide services to its clients in the community?
Oh, absolutely. So we're about a 30-person team now. I was employee 6 or 7. Me and our general counsel, and also my partner, Amy, we were hired on the same day. So we fight about who came first. Knowli originally started as a team of contractors before my time who were providing operational reporting for Florida Medicaid, doing a lot of general data analytics to make sure that federal reporting was done correctly, certain outcome metrics were being monitored, a lot of great and important but relatively basic Medicaid consulting work. As that team evolved, the agency of the Florida ACA, that's the Agency for Healthcare Administration, that's who runs Medicaid for Florida, they started bringing that team on, and then around the time that I came onto the team, they wanted more like data dashboards, enough of these like statistical reports that we're nervous to read. We don't fully understand the statistics. Can you help visualize the data for us so we can make better decisions? That's where I came on. I've been growing my data viz skill set. From there, Knowli has really grown to now serve, I think we're up to 12 major clients. So those are like state agencies, Department of Children and Families, Medicaid programs in multiple states. We serve government clients in Texas, South Carolina, newly added Massachusetts, doing work in New York City now, coming up this spring. Where we've grown is that we really try to work with decision makers who have really complicated big data. And we do several different things in data-driven decision-making. Some of it is we do, community health assessments where we go into a county like Alachua. We do focus groups. We use a lot of those social science research skills. We analyze big data. We analyze messaging that we see from a county health department. And we offer insights, metrics, benchmarking, help them develop strategies to improve public health in a county. Or when we do work for a big Medicaid program, some of the work we actually found out we won a national award from the American Cancer Society. We don't just do that operational work anymore for an agency. We do a lot of that, but A lot of it is actually to help plan and promote certain interventions. So I'll give an example. I talked about cancer screening before. So one intervention that we've been a part of is culling data, looking for particular drivers that might motivate more people to get cancer screenings for preventative healthcare reasons. They're covered by Medicaid, so we want to see more people get them. And then also, how do we incentivize health insurance plans to not just ensure that the people who are likely to get screened anyway, a lot of, especially folks in their population with more privilege, but how do we incentivize health plans to really do the most that they can for those who are underinsured or who face the most, social determinant of health challenges in accessing healthcare? How do we make sure those are the people getting screened for cancer? In this case, what we realized is that we needed to set a threshold, that it couldn't just be certain folks that were targeted for screenings. We had to see that health plans were targeting everyone and that they were getting a majority of the people eligible cancer screened. So these all sound like word problems, but underneath, this is like looking at electronic health records of maybe, worth multi-billions of dollars in claims and multi-millions of people. Even though the individual experience is different, we're able to see measured increases in people getting screened and people getting caught with, not caught, but catching that cancer earlier before it would have developed by the time they got their next mandatory screening. We do a lot of work like this. We help executives develop strategic plans when they come in with a ton of knowledge but don't exactly know how healthcare works on the ground. Yeah. And then we serve some more smaller clients with developing infographics, data dashboards, public-facing work. And I'll send you a link later, one project we have for DCF right now. So if you've been following the opioid epidemic, you've heard about a lot of the funds that are coming down from the feds, from the Sackler family lawsuits and other sources. So our team has been developing risk scoring algorithms and a data dashboard that is public that the state is using to allocate those funds to counties that have the greatest risks for continued opioid use and abuse. So really cool macro level stuff, but at the end of the day, we're really focused on improving positive health outcomes. And we do that working with folks all across the political aisle to get that done.
You guys make our job easy.
Maybe. We also introduce a lot of complication, but that's our job too.
Well, okay. So the way we, especially outreach, the way we conduct outreach, our outreach is conducted off of a lot of data that is given to us. It's very data driven because we try to be strategic as possible so we can be innovative. And with the data that we have, like right now, we know we're targeting 13 to 24-year-olds. We know we're targeting young Black males that are LGBTQ. We know we're targeting young Black or young Hispanic males who are LGBTQ. We know we're targeting heterosexual Black women. We know we're targeting heterosexual young Black men, because those four groups, the data shows us from various metrics, the data shows us that these four groups within the 13 to 24 range here in Tallahassee, Florida, they have the highest risk. And so you guys are doing that and helping us be able to target people better, be able to serve people better. Thank you.
Well, I think part of it too, thanks to everybody who's doing this work, because truly public health it's a huge community effort. And for folks who might be listening or watching, for you to know that even if our paths don't necessarily cross on the day-to-day, so many healthcare leaders and workers in town all really play like we're on the same team. Even when the going gets tough, even when certain hospitals have to shut down because of security breaches, the other ones come in, and because we all know that the hard work gets done together. But that said, I have to confess, I think in this case, it's not just helping the community programs do better, but it's also in some ways, and we consider them partners, so this is a strong word, but we're also a watchdog to make sure that when we look at the data that we're seeing that people who are enrolled, for example, in Medicaid, are getting services and benefits. You would be so surprised, and probably not actually, how many people are enrolled in Medicaid and yet don't get the services that they're entitled to that will protect their health and improve public health. I remember when I first started doing Medicaid work, folks said, well, I mean, it's a government program. What kind of data could there be? And what I tell people is actually Medicaid is one area in which there's so much fraud. Our team does a lot of fraud detection of not individuals looking to get healthcare, but big schemes of folks who are, ordering like durable medical equipment for millions of dollars for patients that don't exist. We have to make sure that all those taxpayer dollars are improving the real health of real people, and that there isn't too much, overspending or waste that's in that process. So our service to a lot of folks in Tallahassee might be more indirect, but at the same time, it's an important way to make sure that no one's being forgotten in the system. I have a fun, easy data story for you.
Okay.
So I won't be specific, but one of our clients, it was a state that discovered they had been underreporting Black and brown infant and maternal mortality by somewhere between 40 and 50% for years. So if you're outside of the healthcare world, we know that disproportionately, just like we were saying with other target demographic groups, right? Like because of social factors and histories that are really complicated and there's oppression involved, there are significantly huge gaps between unexplained by regular, normative medical practice. We know there's a lot of structural racism that exists within the medical system. So we run a lot of analytics to make sure that we're not seeing disparate outcomes between groups, especially in geographic areas. So one way that we've helped identify issues is looking at when OBGYNs on Thursdays and Fridays, especially in South Miami or South Florida, were often having more medically unnecessary C-sections, especially with Spanish-speaking patients. And you have to really think, is this because there's not communication? Is this about convenience for the doctor who wants to not have to manage births on the weekends? This is where our analytics can help say, regardless of what you think's happening, here's what our claims and encounters say is happening. Or, so for this other state that I mentioned, nobody in the state could really figure out how could we be underreporting this? We've been looking at the data the whole time. Dr. Bilal Ghaffari, he's our chief medical officer, and he came in kind of urgently to help. It was within a half hour, maybe an hour of him looking through all the data to realize the reason why this underreporting was happening is because infants aren't assigned a social security number at literally when they're born. It takes weeks.
Gotcha.
So all of these data joins that had been happening based on social security number weren't capturing the truth. And the reason he knew this is because he's not just a data scientist, but he's a medical doctor. He's helped deliver babies. He knows what it's like on the ground.
Right.
So my big piece here is that where Knowli has been successful is we hire people who have, it's not all about the accolades, but we have people who, doctors, registered respiratory therapists, people who have or medical sociologists, people who have been on the ground, see what it's like in clinical delivery and can solve problems. Otherwise, it goes back to people just playing with numbers for numbers' sake and missing the big picture.
Right.
So solving a lot of these inequalities in healthcare isn't just going to be big AI, which is amazing, and we used a lot of machine learning in our work. But it's grounded by the real people who know what healthcare is like on the ground. So this is why we partner with organizations like yours and build those relationships so we learn. Because those big consulting companies with the fancy tech couldn't catch a pretty simple issue of like, wait, we know Medicaid, these IDs aren't assigned the minute a baby's born. Let's really think about how the process works. And so I think about you and the work that you do every day on the ground. You really know not just, the the populations to target, but you know the real faces and
Right.
people in your community. That's how we get the work done.
Yes, yes. Understanding your clients, understanding the patients, understanding the culture of the people that you're dealing with. Real experience really matters when you're looking to connect dots, you're looking to fix issues. Because that was brilliant, having somebody with a real background in medicine and delivering babies to just close that gap. Because some of us, we come from an academic standpoint or a theoretical standpoint, and we
That's
can see
right.
it there, but there's a lot of shadows, and having that experience teaches you how to peek around the corners and be able to identify different things that may not line up to the person who's looking at it from a theoretical view. So that's brilliant. So
Thank you.
now,
I mean, kicking it back to you. Sorry, I think my computer glitched for a second.
no, it's we have a slight delay to it, so it's okay. um,
It's all the tornadoes in the air. Hopefully
I know,
the
right?
mag lab is doing its job.
I know, right? Yeah, keep it away. But now I think that's so cool, what you guys do, helping to make sure that proper data is gathered, but also when the data is given out to your clients, that they can use this data immediately, like it's practical information that they can use and help improve things. Because like in the example you gave, right now we can go to these places and input a new system. Okay, these children don't have social security numbers yet, but we can track the data.
We can
This
definitely track the data better. Yes,
right,
exactly.
right. No, so that is great. So talking about the AI, the technology, because how long did Noli like really incorporate, especially some of this new stuff, this AI? Because I'm a bit behind, so that's why I'm asking about that. Because I could live under a rock a bit, but I know there's a lot of
Not
new
at all.
technology. So
Well, here's my truth is just like the term data science, AI is kind of like this big catch-all that covers everything. Like there's some clients that they don't really necessarily know or understand the differences between like a normal statistical test and the big spectrum between that and like
right,
massive big data AI algorithms. Um, but there's kind of two sides to this story. One is that we don't want to do overly fancy and over engineered just for the sake of being fancy. A lot of our work that we do in public health is basic, clean, gold standard statistical work that isn't, that descriptive, things that aren't even predictive or, taking into account like factors of chance, just looking at the data as it is. But because we work with some of the biggest, and I'll say the word near real time data, meaning that, of course, it's not instantaneous, but we often can see what happened yesterday in a Medicaid program, or when we were doing emergent COVID data reporting, we could see what happened in the last couple hours to be able
wow,
to take that in and figure out those quick insights. So, in terms of machine learning, we now do a lot of, language modeling, and I'll tell you why it's really interesting in healthcare. So you think of AI, and you might think like a lot of big numbers or the image stuff that you see on like Dolly or Chat GPT helping you write your emails. We love all of this. What we often use large language models for, so I'm going to be really, really vague about how this works, but we often think about vectors in AI. So it's all analogies, like king is to queen, as man is to woman, as father is to mother. You can see that they're all kind of related because you're thinking about, oh, it's breaking by gender. So that vector between those two things is gender. Well, imagine that millions of those vectors are being created between words. We use that technology to look at the claims or the medical records, where it's not just the diagnoses that you've written in. Oh, this person has strep, this person has this, but it's the comments that are more fleshed out. Like, patient came in presenting this, arm is broken here in a couple places. Those comments are often even more descriptive and important than the numeric codes that folks enter, like broken bone. It gives that context that actually can even be more powerfully predictive of outcomes than just those diagnosis codes alone. So we try to leverage this in big ways, like identify potentially preventable events so that people don't get left with like scissors inside their body during surgeries, or other people who are using, helping catch things that don't end them back in the emergency room again. So we love playing with these big tools, but it's often, again, like really tailored, not just fancy for fancy's sake, but how can we maybe identify, we often use it, how can we identify people in a population who haven't been diagnosed with something, but looking at the big data, we can tell there might be a likelihood given their history. One that comes up that's related to a lot of the work that you do is that, and just think about like typical medical records. Some of them are really complicated. They have you report whether you've smoked before, you report a lot of your personal details. Well, in Medicaid, it's a lot simpler. It's like gender, sometimes race is filled out, sometimes not. You don't have a lot of that descriptive data. So there isn't, for example, a way for us to say, let's look at all of the LGBTQ members of the Florida Medicaid population. Instead, we think, okay, let's look at the big historical data to see if we can identify people who have been diagnosed or who have been receiving treatment or have symptoms that are similar to HIV and AIDS. And actually, regardless of how they identify, let's see if we can tweak this algorithm, because again, there's no like checkbox in a Medicaid record of identities like that. So we use big data to help identify populations where there is no bucket that exists yet. Of course, they're never perfect, but if you're thinking about, there's 4 to 5, during COVID, there were 6 million people in Medicaid in Florida. Trying to capture big buckets of them and improve health is the level where we can make a difference. So that's some of the ways we use machine learning.
But that's good, because as you were talking, I'm thinking about how we communicate with each other using the Athena network. And the messaging that we give each other back and forth, or the notes that we'll put for a patient if I'm sending a referral, how descriptive I need to be.
Yes.
Because I was taught to articulate my experiences and capture everything that's going on, the good, bad, and kind of put that in there. As much data, as much information, details as possible, so we can help the client. And you guys take that information and flesh it out even further to make sure that policy, even go down and make sure policy is getting rid, that the atmosphere for the patient and the atmosphere for the caregiver is the optimal atmosphere, so we can get healthy people and healthy experiences and great experiences. Because nobody needs to be in the healthcare realm and become disenchanted with the healthcare system, because that's going to make them not want to come back, and they're going to need to come back to get as much help as possible.
And to acknowledge that there is a lot of like disenchantment with the healthcare system. It is confusing. As a person separate from Knowli, it takes me a lot of effort to remember to get my meds on time or schedule appointments, and I have, again, every privilege. So it's acknowledging how complicated this system is, frankly, how historically unfair it has been, and then see how we can like work together to make a difference. You were mentioning too about, we love, and when we look at the data, right, we won't know who coded it. And when we talk, also, to be very clear, we follow a lot of HIPAA rules and protective identities, and things are scrubbed away so that when we do our analytics, we're not putting people at risk. But I was thinking about how you were sharing, you were giving all of these comments. you will never, as an individual, it's hard to know what of those comments or pieces of information will end up being useful. We just
Right.
ran for a county a series of focus groups about what public health resources were available in their metropolitan areas. And while we knew that one of the challenges was where facilities are, it was through people communicating that we were like, oh, it's not about more facilities. It's about better public transportation between them. And it was through their comments and conversations that we were able to say, wait, oh, we're hearing what people need and want, which is so different than when you're kind of disconnected from the real world and you're like, okay, people aren't getting enough services. Maybe we need another clinic. Well, clearly we need more clinics everywhere. But if we're thinking about what, it's in that rich conversation data, like us talking today, that you
Right.
end up getting to those innovative ideas that work rather than just like, oh gosh, should we talk about leadership Tallahassee things of we need to give people what they need and want and not assume. But that's
Right.
the perfect example.
Right. But it's understanding the landscape because, like you say, okay, person A, say you have person A, person B. Both people want to open up a health center because both people, well, one person sees a need, and one person has a perceived need.
Yes.
Person B's need, their vision is more of a more realistic one because it's based off of data and information versus person A who is going from secondhand information, narrative, social media, just different things, or even anecdotal experiences. So, hey, well, I believe we need to put a health center in this rural county, in the middle
Yes.
of this rural county where a lot of people don't have transportation. And we're going to put it at this specific location where person B says, well, we could put it in this rural county,
That's
but
right.
maybe not in this area of the county, maybe on this end of the county where everybody lives because they don't have transportation and they can
That's
actually
right.
get to the health center. So that's where the data will come in to be able to help to make better decisions and get better outcomes from the patients and the caregivers.
And it never is perfect. There's never
Right.
a perfect solution that works for everyone, but this gets us closer. And if I'm going to be honest, I think the biggest picture or the big picture for me is that we're doing our best with interventions in real time, but I think it's more of a movement in public health now. We're trying to build what not even 2030, but 2050 looks like for healthcare and public health. And we care about people's health right now and doing the best we can, but we want to show people we're listening because trust takes a long time to build. And if you
Yes.
really want trusted communities, you can't just come in and tell people what you're doing and just make big changes without building that trust. So I think a lot of public health practitioners, and I see you do it too, it's equal parts health and relationship building. And
Yes.
sometimes let's prioritize the relationship and we're not going to not like poke and prod about every
Right.
possible risk because we're meeting people where we are.
Right.
That's how we're
Right.
going to have a healthier country. It's going to be that slow, painstaking, but such rewarding, as I know work. You know?
No, but it's rewarding, and I'm thankful that you see that too. Even though you work a lot with data, but you work with real human beings, and you have real experience working with human beings. And it's not just from the data perspective, and that's why you get it, and that's why we're thankful that you're the CEO of Knowli, and you all
Oh
are
gosh.
working with the community the way you're doing it. No, but so I always say this, and this is just sincere for me. I'm from Tallahassee. I've seen the worst of Tallahassee. I've seen some
Mm,
parts of Tallahassee get worse, and they're still getting worse. And I've seen parts of Tallahassee getting better. But Tallahassee is a whole lot better now than it was when I was growing up. The young
wow.
kids have access to more opportunities, resources, and everything. When I was coming up, it was either sports or sports. And and now it's so many. I'm proud of our generation for thinking outside of the box, creating as much as they can for the youth, and the youth don't have the same experiences. They can go to the movies, they can play sports, and they can do this, they can do this, they can do this, they
Right.
can jump to all these different things, and it's because
Meaningful, safe experiences.
exactly. It's
Right.
because of people like yourself who come along, who come to Tallahassee, and you bring your energy, you bring your enthusiasm and your ideas to Tallahassee. You've made Tallahassee better. I can definitely tell you. Uh, Sometimes I'm like, man, I should have been born 20 years later because of all the stuff that's available. But I thank you because you don't have to do it. You don't have to be here, and there's so many different factors that could go into somebody giving their best, but despite all of that, you give your best and give it to Tallahassee, and you are a part of us getting better, and I thank you for that.
Oh my gosh. Well, I receive all your words and thank you, but also, it's not that it's that I get to, right? Like, I'm trying to build, just like anybody else, a meaningful life. And the way I do it is, I don't really know what the big picture is. And I could go on a YouTube rabbit hole at 2 a.m. looking at
Right,
NASA and trying to figure it out. But, those PBS videos are very, thought provoking. But
right,
we don't know the big picture. What we know is our community, and we can invest in nurturing it because, I mean, I'm a big believer that it's not always fair, but that karma is real. And the best thing you can do to nurture yourself is nurture other folks. Um,
yep,
and it's the best way to feel good, especially when the times get tough, knowing that you do your best. I mean, come on, I get to
right.
do that. So,
That's so
um,
cool.
and I'm one of those people again. I came to Tallahassee and thought I would leave. And I mean, it's not only a place to build a future, but there is so much opportunity to build, and not a personal future, but like a community future. And really, we're the sixth biggest economy in the United States. And we've got, a lot of exciting action that happens in our green, tiny town. So, it's a
Yes,
cool place.
yes, yes. And our program day where we got to chance to go through Innovation Park.
Oh,
Um,
yeah.
it really opened up more into your world and how the world of technology really blends into just everyday life and just the possibilities of
Oh, yeah.
things that happen in the future if we can just really tap into it and get more people interested in STEM, get more young people understanding how STEM really goes into our society functioning. Um, the future will be very, very, very bright.
And I got to tell you, I know right now, and this is because of where we are in our growth as a company. So we have a lot of, former doctors or current, still clinicians who practice and PhDs, but that's not required for having a meaningful career in STEM or the arts, which are so intertwined with STEM and innovation. We, as Knowli continues to grow, we're centered here at the Tallahassee Community College Center for Innovation downtown.
Okay,
We
cool.
love community college applicants or folks who have found certifications to get these skill sets. It's not all behind. We also are proud university partners with FAMU and FSU here in town, but it doesn't all have to be behind, tens of thousands of dollars of student loan debt. Like, what I want people in Tallahassee who are coming up now, or even who are, young professionals now, to know is I'm living proof. Opera singer, told people I was smart but bad at math. And was I really bad, or just did I not get 100 every time? I think that binary thinking, you know, there's spots for everyone. And us as hiring, we're not looking for perfect people either. We're looking again for people who have experiences or expertise that can add to what we do. And then, that drive to make a difference, the impact. So it's really a broad
Yes.
call to everyone.
I have a young lady who's interested in IT. She's at the beginning stages. She's wanting to learn more. I'm going to give her your email and have her
Please
reach out.
do.
She needs
And
to sit down and talk.
I would say this too, it's not just me. We've got this whole team. And I've mentioned to you before, we have a former NFL player turned epidemiologist on our team. We have a lot of folks who I think have also ended up at Knowli because they've come through, or, a former Department of Health prosecutor of emergency action cases of, doctors who were, abusing in multiple different ways their patients, revoking those licenses and calling them to task. Those are the people on our team. So it's not just me. We've got this like stable of rock stars. I feel like I'm in a superhero movie every day of like, all right, we got a big problem with this client. Who's got this skill and that thing? I think all of us are happy to have anybody come join us on our Thursday lunches and hang out and learn from us too. We're a cool bunch. I'm really lucky to have an awesome team.
And we're lucky to have you. We're lucky to have Knowli. We're lucky to have just all of the resources and experience and the love that you bring to our community. Once again, through the lens of STEM, through the lens of data sciences and technology, and just being able to utilize every aspect of, like, you are literally utilizing every aspect of your talents, your gifts, your passions, all those things. I know we're running out of time, and I want to get into the opera, but we're gonna have to bring you back to have a whole separate conversation about your career as an opera singer and just the experiences with that. Because I definitely want to talk about that more. So we're gonna do a part two. This is part one, people. This is part one.
Oh my gosh.
Part two.
You're so kind. Thank you.
No problem. Because it's interesting, so we got to know. We have to know. So, how can people get in contact with you? How can people learn more about Knowli? What's the best way to learn?
So we've got a website, Knowli, that's spelled KNOWLI.com. We're really active on LinkedIn. That's often where we share more of we often can't directly share the work that we do for our government clients because we're, in many ways ghostwriters, but we often talk about the methods that we have or the work that we do. And then, hey, I'm happy to pass along an email if folks want to get in touch with me. I'm easily Google stalkable, so you can add me on Facebook too, or Emily, EMILY. My last name is SARAS @knowli.com. Happy to get in touch.
Yes. And that information will be in the description of this video. Once again, like I tell you, we do our best to not disappoint, but that's why we do our best to bring on great guests with great information, great experiences, so we can continue the tradition of having these resources available. Like I said, digital resource with great people who do great things. And this Tallahassee community, I mean, what can I say? I'm just keep bragging about this Tallahassee community. So
Uncle Joe, thank you so much for your kind words.
Oh, no problem. Thank you. Look, Emily Saras, my people, Emily Saras. I am Joseph Ward. This is Mind Your Body and Soul, and we will see you guys next time.